What healthy nails look like, what the lunula of your nails says about your health. Believe it or not, your fingernails can tell you a lot more about your health than you might think. The crescent-shaped area at the base of your fingernail may indicate if you have some kind of health problem, even if you don't notice any other symptoms. Pay attention to what the lunula of your nails might mean, because there are a lot of possible concerns that might be important. What the lunula should look like on each finger. Pinky finger lunula. Nearly invisible or non-existent. Heart. If you notice that your lunula is larger than normal, pay attention, it could be related to high blood pressure. Ring finger lunula. The lunula on your ring finger is related to your reproductive and lymphatic systems. If it's barely visible, it might indicate a problem related to your metabolism. Middle finger lunula. The lunula on your middle finger could be related to your brain function or cardiovascular system. If you can't see the lunula on this finger, it could indicate a potential problem with your blood vessels or high blood pressure. Index finger lunula. The lunula on this finger could disappear or be nearly diminished due to a malfunction in your intestine, pancreas, or a chronic disease related to your upper respiratory tract. Lunula on the thumb. This lunula is related to the function of your lungs and spleen. It's the largest of the 5 and should take up no more than 25 of the entire length of your nail bed. If you find that it's smaller, it could be due to tobacco use. If it's larger than this size, it may be due to high blood pressure. Is it large? If you're not sure if your lunula is too large or small, it's worth remembering that a lunula is considered large when it takes up a third of your entire nail. This could indicate problems with your cardiovascular system, changes in heart rate, or low blood pressure. It's also seen in people who do heavy physical activity for work or are under a lot of stress. Is it small? A lunula is considered to be small when it cannot be seen or barely extends beyond the surface of the cuticle. This could indicate low blood pressure or circulatory problems, as well as a weak immune system, slow metabolism, and an iron or vitamin B12 deficiency. If you notice that your lunula are clearly isolated with a transversal line to the rest of the nail, you could be having blood sugar problems or developing diabetes. Invisible lunula. Keep in mind that sometimes you might not be able to see your lunula, but it doesn't mean they're not there. If it has truly disappeared, however, it could be a problem with your circulation. The absence of a lunula could be related to thyroid problems, a lack of vitamin B12, or an iron deficiency. Color changes in the lunula. This shade can also be related to problems with digestion and a difficulty absorbing nutrients. A white lunula indicates that everything is in order, as this is the natural color. Remember that your lunula should be several shades lighter than your skin tone. If your lunula is more violet in color, it could be a sign of poor circulation and a lack of oxygen in your organs and tissues. Pink or red lunula may indicate low levels of physical activity and lung problems. Finally, If you notice that your lunula are black in color, it's a symptom of heavy metal contamination. If this occurs, see a doctor immediately.